Hey everybody, this is Dr. Mark Millar. Today we're discussing the basics of lithium and the safety guidelines while utilizing lithium orotate. This is part 2 of a 3-part series, so if you haven't already reviewed part 1, please do so now. As stated in part 1, my main concern is for your safety. This was and still is the most important part of the published findings regarding lithium orotate. While it is true that anyone can utilize lithium orotate while under the supervision of their physician, the reality of the situation is that most people are utilizing lithium orotate without the guidance of their physician. So I think it's critically important that I give you some safety guidelines. I go into much greater detail in my book regarding these safety guidelines, but for now I just want to give you an introduction so you can begin using lithium orotate with confidence that you're doing it wisely and safely. Towards the end of this video, I will give you a formula to help you understand what is the safe amount of lithium that you can take without monitoring your lithium levels and kidney function. But first I want to go over some of the basics of lithium orotate. What is lithium? How does it work? What's lithium orotate compared to pharmaceutical lithium, etc. So let's start with what is lithium? Well, it turns out lithium isn't a drug, even though it has been approved as a drug by the FDA in 1970. The fact is, since time immemorial, lithium has been and always will be a mineral. It's a trace mineral. In fact, it's the smallest solid element on the periodic table of elements, sitting at the number 3 position after hydrogen and helium. So it's the first solid element, it's the smallest with only 3 electrons, and it's an alkali metal in the same class as sodium and potassium, having many of the similar qualities of sodium and potassium as well as magnesium. So what is pharmaceutical lithium? Well, it's a naturally occurring lithium salt that is mined all over the world. Lithium is commonly attached to a carbon atom. This is what we call lithium carbonate. The miners take it out of the lithium brines where they find the lithium, they dry it out, they package it up, they add some color dyes and a few other things to it, and they call it pharmaceutical lithium. But essentially it is simply lithium carbonate. It's a naturally occurring lithium salt. It is not a drug. So what is lithium orotate? Well, it's simply the attachment of orotic acid, which is a naturally occurring organic acid created naturally within the cells of our body, and orotic acid is also ingested through many food sources. So we take the orotic acid and we attach it to the lithium carbonate, and now we've made a super mineral transporter lithium salt that is fully absorbed. No longer do we deal with partial absorption. This is the breakthrough of lithium orotate. 100% absorption. We know from the MRS brain scans, magnetic resonance spectroscopy, that we can actually measure lithium absorption within the cells of the brain. This has been done on numerous occasions, analyzing pharmaceutical lithium, and the absorption rates varied from as low as 30% to as high as 70% for pharmaceutical lithium. The average or mean being around 50%. So if that's the case, that lithium carbonate, or the pharmaceutical lithium, is only partially absorbed and lithium orotate is fully absorbed, then we can reduce our lithium levels significantly. And this is important for the bipolar and post-traumatic stress individuals that are taking really high lithium levels and want to reduce those levels by for perhaps 50% or more. And this takes you out of the toxic side effect inducing lithium levels. So this is a breakthrough. When I help people convert from pharmaceutical lithium to lithium orotate, my clients generally reduce their lithium levels by 50% or more. Some will take more, some will take less. It varies from individual to individual. For example, if you're a bipolar individual presently taking 900 milligrams of prescription lithium, you're ingesting approximately 170 milligrams of pure elemental lithium from the lithium carbonate. So for my clients in that situation, taking 170 milligrams of pure elemental lithium, most will end up taking half or 85 milligrams or less to maintain their balance. Everybody wants to know if lithium orotate causes side effects. Well, the truth about lithium is that it is not inherently toxic or cause any side effects unless you exceed the level that is appropriate for you to take. As I said before, it varies greatly from individual to individual. But the good news is that most of us are taking so much less lithium that we don't suffer with side effects. What are the common side effects of lithium orotate? Again, if you take too much of it, the most common side effects are a headache, apathy, just feeling a little lethargic, a loss of appetite, or a loss of, physical strength, particularly noticed in the hand grip strength. When we come off of high levels of stress, our energy, if we come down off of adrenaline, for example, our energy will naturally come down. That's our more relaxed state. So that's a healthy state to be in, day out. You don't want to be in high adrenaline just so you can be strong all the time, because it's devastating to you. So as you know, pharmaceutical lithium is known to cause a lot of side effects. And this has gained a reputation for lithium as being something dangerous, that you have to monitor your lithium levels, that it may damage your kidneys, etc. I want you to be really clear about this. Lithium is not inherently toxic, but like all other minerals, it does have a maximum safe limit for each individual depending on their unique biochemical individuality. So when you ask, does lithium orotate cause side effects? The answer is absolutely not, unless you take too much for yourself being an individual. All of these symptoms disappear when we bring the lithium levels down. And so I want to say it again, lithium does not cause side effects unless you exceed the level that's appropriate for you. One of the drug interactions that can occur with lithium, pharmaceutical or lithium orotate, is called a serotonin syndrome. Lithium is such a great stimulator, producer of serotonin, that when you take it with an antidepressant, an SSRI, that basically what SSRIs do is that it blocks the reuptake of serotonin, so it leaves the serotonin in the synapses between the neurons, which gives us this illusion of feeling good. There's a very simple way to avoid a serotonin syndrome, and that's by simply increasing your lithium levels very slowly. So if you're adding this on top of an SSRI, I recommend you start with just 5 milligrams and wait at least 2 days before you add the additional 5 on top of it. So you can go up 5, 10, 15, 20 milligrams, for example, over a week or so. And this should avoid any serotonin syndrome, which, by the way, is simply felt as jittery, a little nausea in the stomach. In the severe serotonin syndrome, individuals have thrown up. And the good news is, this will pass in a matter of hours as the body adjusts to the lithium, etc. So if you're experiencing this, it's temporary. Don't take any more additional lithium. Let the lithium wash out for about 24 hours before you start with another small amount of lithium, and then slowly build back up. And if the serotonin syndrome occurs again, then obviously you're either going to have to lower your lithium levels, or this is the first opportunity to reduce the SSRIs. Doctors have done this in clinics. We get an SSRI situation, we reduce the serotonin reuptake inhibitors, and then we can keep taking the lithium orotate without the serotonin syndrome. And it's pretty straightforward. So this is the end of part 2 of a 3-part series on lithium orotate. If you need further assistance, please feel free to call me for a consultation. You can reach me at 480-282-1545. If you cannot afford a consultation, please call for a free 3-minute introductory consult to help you get started and get on track with lithium orotate. I want to reiterate again that I no longer practice chiropractic. I no longer maintain an active license to practice chiropractic. I'm not treating you as my patient. I'm offering you my services as a consultant. This information is for educational purposes only, and before you use lithium orotate or make any changes to your medicinal protocols, you are advised to consult with your physician. In part 3, we're going to go over lithium orotate dosing and what are the safe maximum limits utilizing this incredible mineral. I look forward to hearing from you. God bless.